Joining us today. Today we kickstart a webinar series on lung cancer. Today we talk about risk, symptoms, and basic concepts of treatment of lung cancer. And we're very happy to have with us Dr. Itesh Khatwani, consultant medical oncologist from Oncowin Cancer Center, Ahmedabad, and Dr. Mukesh, consultant medical oncologist, Alexis Hospital, Nagpur. November is Lung Cancer Awareness Month, so we will be doing a series of conversations around lung cancer. Lung cancer is one of the top few cancers in India, and it's also a leading cause of death, not just in India, but also globally. And I think today we will go through, and it's also important to understand what we as individuals can do. So we will try and unpack why the prevalence is high, what are the risk factors, what are the symptoms, and what we can do to identify the symptoms early and take proactive action. And really, the key importance is that proactive action and early action improves outcomes. So I think that's something that we must always remember. A quick reminder to those of you who are not aware, Patients Engage is an online platform for patients dealing with chronic diseases and their caregivers to share personal experiences and learn from each other, as well as from healthcare professionals. And the idea of the learning is to make decision-making processes easier. And more importantly, I think for all of us to know that we're not dealing with any condition on our own. There are others in a similar situation, or, we can get support from others as well. So information really is about empowering patients and their families. We've always put patients and survivors at the center of all of our content. It's through the conversations we have with patients and their families that we identify the topics that they're interested in and have these conversations with doctors and patients, etc. as well. And we cover various aspects of dealing with a condition. This webinar series is supported by Pfizer, and it's issued in public interest by Pfizer. The content of this video is meant for information and awareness purpose only and should not be construed as substitute for medical advice. So if you are if you get some information through this, please do consult your doctor for your specific medical issue. Also, we will not be discussing any specific brand names or any specific molecule names. So, this is high level information for you to understand the disease better. The views expressed in this video are speaker independent views, and Pfizer or Patients Engage may not necessarily endorse the same. As always, remember that this is not replacing a medical consultation. So do consult your doctor or any of these doctors directly for specific medical issues. And we will take your questions. We are live on Zoom, Facebook, and YouTube. So you can ask your questions through any of these channels. Or you can always write to us at editor@patientsengage.com or through our website. So let's get started. Thank you, Dr. Itesh Khatwani and Dr. Mukesh Bang for joining us today. Dr. Itesh, could you explain what is lung cancer and, what's the prevalence and incidence in India?
Yeah, good evening, Mrs. Aparna. Thank you for the kind introduction, and I would like to congratulate Health and Patient Engage team for doing a wonderful job for creating awareness of the patient. So, coming to the question, lung cancer. Basically, all the cells in normal phase they work in a cell cycle. They have a proper cell cycle. When if the cell is abnormal, they get destroyed because of the body's mechanism. But when some cell is abnormal and it is not under the control of genes because of some defect or mutation, it becomes uncontrolled growth and it leads to a swelling or cancer. So lung cancer, if we talk, it is one of the leading cancers worldwide as well as in India. It comes in the top 3 cancers in India and second most common cancer in the world. And unluckily, it is the top cancer killer, as you mentioned previously also, is the leading cause of cancer-related death and one of the leading cause of non-communicable disease-related death worldwide as well as in India. So that is definitely a serious concern. If we talk about the numbers, around 80,000 cases of lung cancer were officially declared in India by Globocon. And almost most of the cases are diagnosed in advanced third stage or fourth stage. That is the sad part because
Right.
the tuberculosis, which is again common in India, and we will discuss the symptomology and everything in further details.
Right. Thank you. Thank you, Dr. Hitesh. Dr. Mukesh, what are the, we talked of lung cancer. So what are the signs and symptoms of lung cancer typically?
Thank you for inviting, first of all, Patients Engage and Mrs. Aparna. So basically, the signs and symptoms, if you talk about lung cancer, the symptoms are like most of the patients come with cough which is not resolved by the routine treatment, like just all treatment measures done, but the cough has not been resolved. Sometimes they come with breathlessness. Sometimes they come with chest pain. The voice is changed. Sometimes they have loss of appetite and they couldn't find anything on routine evaluation. Sometimes if the cancer is there, it has spread to other parts of the body, or then they will have a fluid in the chest or in the abdomen, or they have some bone pain. And sometimes the patient suddenly comes with the convulsions and headache. And when we do the scanning, we see that there are some brain lesions, and then we try to find out from where it is coming. We see the lung is the probable cause for it. So these are various symptoms. If we talk about signs most of the time we see the consolidation or pneumonic patch on the lung, which is not resolved with routine antibiotics, and the pulmonologists, physicians are treating, but it is not getting resolved. Then we try to see and deep dig the etiology. Then we try to find it's lung cancer.
Right, right. Thank you, Dr. Mukesh. So, Dr. Hitesh talked of, some of these signs, patches on the lung, etc. Dr. Hitesh, can you walk us through the process of diagnosis? Because obviously, if there's a patch on the lung, it's picked up either through an X-ray or a CT scan. But, so if you can just walk us through that, and where are the gaps as well that we are seeing?
Exactly. Yeah. So as Dr. Mukesh said, that most common finding is a patch which we find in the lung, probably on X-ray or CT scan. So if a CT scan is not done, we go for the CT scan of the lungs to start with. And usually the CT scan picture shows us that there is some mass lesion or some tumor swelling in the lung, along with involvement of surrounding areas, which shows us the doubt of lung cancer at first. So when we suspect the lung cancer, we need to confirm it with biopsy. It depending upon the site of the disease, we need to biopsy it either by endoscopy, bronchoscopy, or by imaging guided via CT scan, in which a small tissue is taken from the tumor site and it is sent to the lab for further confirmation. Biopsy helps us to confirm the presence of a cancer, type of the cancer, whether it is lung cancer, which subtype is there, and also it helps to diagnose further molecular testing and special tests. Again, once we have confirmed the lung cancer, we need to do the staging to find out what is the spread of the disease. So
Right.
for staging of the lung cancer, we might need to, apart from CT scan, we might need to do the PET scan of the whole body as well as MRI brain in selected cases. Again,
Right.
the major gap which we see in India, presentation of tuberculosis and lung cancer is quite common symptomatology wise. So many times it happens that patients do take anti-tuberculous drugs for few months, and when they are not responding or they worsen, then they are referred us or they are thought of lung cancer. So this point should definitely be kept in mind whenever we see such chronic symptoms. It should be investigated thoroughly, and we should confirm whether it is tuberculosis or CLL. Specifically, when we are dealing with patients who are chronic smokers or those who have chronic addiction or those who are elderly. Again, in biopsy, we need to see the type of the tumor, and some special tests are done to decide the therapy. And final stage is decided, and according to that, we decide the therapy and further plan of the patient.
Right. Thank you. Dr. Mukesh, Dr. Itesh touched on smoking as a risk factor, but if you can, obviously smoking is a big risk factor, but if you can talk about all of the other risk factors as well.
See, most important, I think you may be knowing, we know that India is one of the second or third, I can say, largest consumer of tobacco. So we talk about lung cancer, but we are one of the top three consumers of tobacco. If we talk about the population in India, I think maybe 28 to 30% of the population, they use tobacco in any form. Among that, 30 to 40% of the males are there, and 10 to 15% of females are there. So tobacco in any form, by smoking or inhalation in any way, passive smoking, this is the most common cause. Sometimes people ask us question, sir, we don't smoke, then why we get this cancer? So if you talk about lung cancer, 80% of the lung cancers happen in the smokers, and 20% of the lung cancers are in the non-smokers, but there are other risk factors like the exposure to air pollution. Then you talk about passive smoking by other persons smoking in front of you. Then
Right.
asbestos, radon, the chemical factories. Then we have some sort of rare genetic mutations, and these are other risk factors which can cause the lung cancer among those 20% of the patients. And definitely, we should be very careful. We should not smoke ourselves, and we should not inhale the passive smoke also. That is very important. And I know that's a very funny thing that the packets have it injurious to health, but still it is there and it is people are consuming. But I think that some way we have to change that, and we should stop smoking and avoid self intake and the passive smoking also. That is very
Right.
important
Right.
factor.
And because you talked of some of these risk factors, can you also talk on the gender differences in prevalence? Because earlier it was seen as so closely linked to smoking that you often did not hear of too many women getting it, but now increasingly you are coming across, especially non-smoking women also talking about lung
So
cancer.
So the thing is, see, previously the lung cancer was divided into different subtypes like uh, adenocarcinoma, squamous cell carcinoma, and small cell carcinoma, and different varieties. But now we divide histopathological lung cancer into two types: non-small cell lung carcinoma and small cell lung carcinoma. Small cell lung carcinoma is prevalent in the smokers. In non-small lung cell carcinoma, also squamous is common with the smokers, and adenocarcinoma, a few percent of the patient, as I told before, 20% of the patients are non-smokers. In that, there are some genetic risk factors or other exposure factors which causes lung cancer to those patients. And most of the time, when we talk about lung cancer, if the patient is a non-smoker, there are guideline derived. If the patient is a non-smoker, Asian, female the patient. So automatically, most of the patient they come the genetic test which we do on the histopathology, as Dr. Itesh told, we do, and we try to see more of those patients come with the molecular gene target mutation targets, and those are the gene which troubles the patients in a non-smoker situation.
Right. Thank you. Dr. Ritesh, we talked of how most people present themselves in a late stage, but if you can talk the audience through the stages of lung cancer and, are the signs in the early stages different as well, if you can touch on that.
Basically, there are 4 stages of lung cancer. Stage 1, lung cancer is limited to usually lung tissue only. When the disease spreads to surrounding lymph nodes, then it is stage 2 disease. Broadly, I can say. For stage 3 disease, the disease has spread to the surrounding structures, or it is touching the surrounding major vessels or lymph nodes which are in the mediastinum, which are distal lymph nodes relatively. For stage 4, the disease has spread to other parts of the body, like it has spread to liver, it has spread to bones or brain, or there is a fluid collection surrounding the lung because of cancer. So definitely earlier the stage, better the result with minimum possible treatment and more are the chances of cure. Coming to the signs of lung cancer, the sad part is that most of the patients present in advanced stage, because early stage lung cancer usually doesn't cause much trouble to most of the patients. So it is
Right.
silent. It silently grows, and when the disease spreads to stage 3 and stage 4, then only it becomes symptomatic in majority of the patients. Awareness as well as disease location and biology is the thing which is very important to diagnose the lung cancer early. And in early cases, as Dr. Mukesh said previously, the common symptoms are breathlessness, chronic coughing, blood in cough, chest pain.
Right.
And in advanced stages, when the disease spreads to other parts of the body, there might be significant weight loss, there might be jaundice, there might be back pain, or symptoms related to brain, like headache, convulsions, or weakness in the body parts.
Right. Thank you. Dr. Mukesh, depending on the stages, do the treatment options vary? And if you can talk through the treatment
So
options.
definitely, stage determine your treatment. So up till 2022, I can say in a very early lung cancer, even the percentage is very low. I can say 4 to 6% probably, which comes in a very early stage and surgically resectable situation. Surgery is the treatment of choice. Otherwise, most of the time, stage 2, stage 3 patients, uh, those patients are patients for chemotherapy, radiation therapy, and there is a new data of using immunotherapy now. So now we have started using immunotherapy also before going for surgery or before going for chemoradiation and after chemoradiation also. So these are the treatment guideline for stage 1, 2, 3. And if we talk about stage 4, there is a huge basket of treatment options in stage 4, which starts with your uh, the uh, the histopathology, followed by your molecular testing. And depending upon molecular testing, we divide the patients in different treatment subsets, because we
Right.
always try to see immunohistochemistry on histopathology. We do molecular testing, which most of the time involves some of the molecular targets like EGFR, ALK, ROS, PDL1, then BRAF, MET. These are some mutations which we check by the NGS panel on the lung cancer histopathology samples, because nowadays many of the lung cancer patients are only on oral tablets because they have this gene positivity, and those drugs are very friendly drugs, and the patients can survive for 3 years, 4 years, 5 years also without any side effect profile. And if we don't find any target on any of this, then we try to see the PDL1 immunotherapy markers, and then decide whether the patient should take only chemotherapy or immunotherapy along with chemotherapy. So there is a huge basket of treatment options in lung cancer, and I think we always try to see each and everything, and depending upon the immunohistochemistry and the molecular profiling, we treat the patient differently.
Thank you. Thank you, Dr. Mukesh. Dr. Itesh, we talked of some of the genetic testing as well, but should all lung cancer patients be tested for genetic mutation, or is there a way you select who should go for the testing?
This is very relevant question because it is very important to do molecular testing to be specific in selected patients. Those patients with adenocarcinoma type of lung cancers, irrespective of the history of smoking, they must be go for molecular testing. Those patients who are never smokers, who have never smoked in life, they should also definitely go for molecular testing. These are bare minimum patients who should go for molecular testing, or those who are occasional smokers in selected subtypes or with
Right.
mixed pathology like adenosquamous with rare smoking history or no smoking history. These are the patients who are more likely to have some genetic mutation which is having a target drug available. These are the patients who should be tested for genetic mutation. Apart from this, when we are planning for immunotherapy, again, genetic testing takes an important role along with PD-1 testing.
Right. And a follow-up question on that is that, while they're waiting for these, because this test sometimes takes a bit longer, 2 to 3 weeks, for the results to come back, are they supposed to wait for and not start any treatment because that's one of the things
So,
we often hear
so
from patients, right? That,
basically,
sorry, go ahead.
yeah. So basically, what happens, we always assess clinically. Clinical examination is very important for the patient. If the patient is in distress, if the patient is having effusion, ascites, and the patient is having load of disease, so we cannot wait for the molecular reports to come. So we have a general chemotherapy regimen which we prefer for all these patients, and we start with that regimen and wait for the reports to come. Usually, it doesn't take 2 3 weeks. It takes 7 days, 5 7 days max to have those reports with us to decide for the further plan. So automatically, for a medical term, it is called visceral crisis. When the patient is in visceral
Sorry, the
crisis,
medical term is what?
visceral crisis. Visceral
Visceral
crisis means when
crisis.
organs are
Okay.
getting damaged, or any
Right.
liver functions are damaged. If the patient is having brain metastasis, then you have to start with radiation to the
Right.
brain, or
Right.
any effusion is there, the fluid along the lungs, then we have to tap the fluid and start chemotherapy. So automatically we start first dose of chemotherapy, and we try to wait for the results to come. And once the reports come, we decide whether if the with the chemotherapy, if the patient is feeling better, we try to continue for 4 cycles, and based on the molecular profile, we then add the drug or change the drug and shift. Otherwise, if we don't find molecular therapy relevant to the case, then we continue the chemotherapy and we put the patient on maintenance therapy. Everything is based on the molecular profiling of the patient.
Right. Right. And in cases where it's not, the testing does not come back as any of those targeted genes, then what are the treatment protocols that are typically
So if the patient is a molecular target negative, then we have option of chemotherapy plus minus immunotherapy. If the immunotherapy markers are positive, now there is a data. Even if the immunotherapy markers are negative, still you can consider immunotherapy along with chemotherapy. And once we finish 4 to 6 cycles of chemotherapy, we try to put the patient on maintenance, either immunotherapy along with a single agent and chemotherapy drug, and try to continue the maintenance therapy.
Right. Right. Okay. Dr. Itesh, one of the things that people are always concerned about as soon as cancer is diagnosed is, what they can do in terms of their diet, and we always add in the topic of exercise, because we think that exercise is not given enough importance in our country. So if you can talk through, what is the role of nutrition and what should patients be looking at as nutrition, and also what they should do in terms of exercise.
Nutrition is definitely very important part of any cancer treatment because as we discussed, most of the patients do present in advanced stage. If we talk about lung cancer, so many of them have weight loss, many of them are malnourished. So definitely nutritious, specifically high protein diet is recommended for them. Obviously that needs to be individualized to some extent, but as such we try to give more protein diet. We specifically have a multidisciplinary team. We definitely have dedicated dietitian who decides it diet plan for each and every patient. As such, there are no significant restrictions for the patient for from diet point of view. There is a misnomer that patient should not consume more sugars, or they should definitely consume less diet. Which definitely I want to say clearly that this is the state of catabolism, and patient needs more nutrition and more diet as compared to normal human. So diet is very important part of any cancer, and specifically for lung cancer, definitely we need to focus on the diet of the patient on individual basis. Coming to the your second question, sorry,
Was around
apart from diet,
exercise.
exercise, yeah. So again, exercise is a definitely individualized thing, but definitely lung breathing and lung building exercises should be recommended depending upon the fitness of the patient and the quality of the lung. Those patients who are undergoing surgery, they definitely need post-operative physiotherapy and lung therapy to improve their lung capacity. Overall, also, if patient is otherwise fit and reasonably healthy, we do recommend routine exercises, routine walking, and to some extent yoga pranayam. Definitely they should be able to do that unless the patient is critically ill or requires oxygen support.
Right. Right. Dr. Mukesh, would you want to add anything to that?
I think everything he has covered. Only the point is the small quantity of diet at a frequent interval, which is very important. And as Itesh perfectly told, that people they do they need to increase their appetite, and they need to take more and more, so that they should be healthy during this period of time, because automatically chemotherapy, all these drug therapy are, it's not a easy treatment otherwise also. And the appetite should be good, and the patient should take a healthy diet automatically, and they will keep themselves energetic with that. And
Right.
hydration is very important. Hydration is very important factor.
Right. Right. Um, and in terms of, we've talked of lung cancer for the last 25 minutes. What can be done to prevent lung cancer? Dr. Itesh?
So definitely, as we discussed, that majority 80 to 90% of the cases of lung cancer are due to smoking related in any form. So these are related to habit or these are reversible. So
Mm.
first of all, definitely there should be big no to any form of tobacco, which is a primary prevention, which will automatically decrease the cases of lung cancer. Second thing is secondary prevention. Those who are at high risk of lung cancer, like those who are chronic smokers, for these patients, we should do regular screening in the form of low dose radiation CT scan at regular intervals, say 1 year, to
Mm.
assess if there is any nodule in the lung which is suspicious for malignancy, which should be worked up for lung cancer. In this way, we can diagnose lung cancers at early stage, at which we are missing at present.
Right. Right.
So in Western world, there is a culture of doing this screening, which is known as screening, to
Mm.
detect the disease when there are no symptoms. So basically, those who are not having symptoms, but those who are having prone to disease, they should be investigated with low dose CT scan annually to detect lung cancer when it has not created the symptoms, but it is in the early stage. And
Right.
definitely by avoiding smoking, majority of the cases can be avoided.
Right.
I think one more point to add actually during COVID period, there were more CT scan done. So we found few cases
Of
based on
early
CT
stage.
during COVID also that they came in a early stage lung cancer. I had two, three patients who were diagnosed very early because of the COVID situation and they did a CT. So
Yeah.
Absolutely,
automatically,
I
yeah,
agree.
No,
I
yeah.
had
Yeah.
four
I
patients
think,
during
yeah.
that 2 years
So
period.
yeah,
during
I
that
think
time, we
we've
found
heard
more
this for the
patients.
last 2 years. That's what we've heard
Yeah.
from a lot of doctors that, COVID, the CT scan did help identify a few early case
Yes,
lung
yes.
cancer.
Because otherwise we don't see early cases. We hardly find any early lung cancer cases. Automatically either stage 3C or stage 4. That is
Right.
automatically it comes to us.
Right, right. And
Agree.
and we obviously talked of a very known risk of smoking, but and certain cancers like breast cancer, family history matters a lot. Is that the case in lung cancer or not really? And this is for either of you.
So I think there is no there are few case reports I can say, but there is no great genetic factor, inherited genetic factor which causes lung cancer. There is
Okay.
no great data to comment on it actually.
Right. Okay. Yeah, no, because there's some cancers, right? Like breast cancer and
Yeah,
colorectal
breast,
cancer,
ovary, stomach, they have a correlation, but in lung, it's very
lung
specific
cancer.
few case reports, but not, I can say, to count in a huge number actually.
Yeah,
Right.
no familial inheritance we have seen in practice.
So,
I agree.
okay. Right. Any final words, Dr. Mukesh?
I think we should have a healthy diet. We should exercise ourselves every day, and we should maintain our weight, body. No to smoking, tobacco chewing in any form. I always see when I go out on a vehicle, I always see people canteen tapri ke paas बैठे रहते हैं. The office workers, they have one hand with the tea and one hand with the smoke, the cigar in the hand. That I really feel bad for that because that habit the people should change and stop that habit because that is very notorious and very high risk factor for cancers in any form of cancer, not talking about lung. For any cancer, smoking is automatically a very hazardous thing. And I
Right.
think we should maintain our body weight and healthy diet that is good enough for us and screen regular at regular interval.
Right. Right. Dr. Ritesh?
Yeah, I agree with Dr. Mukesh absolutely that no to and big no for any form of addiction, healthy lifestyle, regular
Mm.
screening in general, maintain body weight with good exercises and healthy diet, and awareness about the disease symptomatology to some extent, where we should consult the doctor and get it diagnosed at early stage and screening at regular intervals. These are
Right.
the things we should be kept in mind always.
Right. Thank you. Thank you, Dr. Ritesh, and thank you, Dr. Mukesh Bank, to joining
Thank you
us
very
today
much.
and
Thank you.
to
Thank you
talking
very
to
much.
people. Quick reminder that, as both doctors have said, that if you are a smoker, do quit smoking, and even quitting smoking reduces your risk over time. So do quit smoking as soon as possible. And there are tools available, there is assistance available, helplines, etc. So do take whatever help you can to quit smoking or any form of tobacco, and do not ignore your symptoms for any periods of time. Things like cough, breathlessness, which are seen as non-specific symptoms, do not ignore them. Do get it checked out, and be aware of whatever changes your body is going through, and as both doctors have said, maintain healthy lifestyle. So thank you everyone for joining us today, and thank you again once again, Dr. Itesh Khatwani and Dr. Mukesh Bang.
Thank you.
Thank you, Patients Engage, and thank you, Mrs. Aparna. Thank you very much.
Thank you.
Thank you, Itesh.